Good evening, everyone. The past 24 hours has had a lot of interest in what I do as a cardiac electrophysiologist. Most people don't know that there's an electrical system to the heart until it breaks, and then it gets a lot of news. With the Buffalo Bills player who went down last night, my phone has been um, sort of blowing up from people asking what exactly a sudden death in athletes and what did he have happen to him, what occurred. And there's been a lot of questions that the media, as of the making of this video, has not released the exact cause of what happened to him. But as electrophysiologists, we specialize in sudden death, both in the treatment and the prevention. So one of the things that we talk about is the sudden death in athletes. So I thought, just to make things easier, I would show a quick little demonstration exactly what sudden death in athletes entails, and we'll go from there with it. One of the things that you're faced with sudden cardiac death is that there's all different types. The most common type is hypertrophic cardiomyopathy. That's the most common. The second most common is the Commotio Cordis, which is what people are speculating happened to the Buffalo Bills player. There's other ones as well. When you have a high impact trauma, you can have things like rupture a coronary artery, or you can rupture the aorta. Don't know his other personal medical history. He could have had long QT syndrome. He could have had some degree of myocarditis. We're seeing a lot more myocarditis with the COVID outbreak, so it could have been in that as well. So with the Commotio Cordis, that's basically a Latin phrase for the commotion of the heart. Some people call it like agitation of the heart. But what happens is, in the cardiac cycle, as the heart fires, if you make it refire when it's not ready to fire again, you can disrupt the entire electrical system. I tell people it's like this. Every heart cell is like a mousetrap that is set and ready to fire. They're all supposed to fire in series like a row of dominoes would fall. However, if you make them fire so that one starts in the area that's not ready to fire and one starts when it does, you can make these waves of electrical activity hit in such a way that everything goes into disarray. So the Commotio Cordis occurs that if you have enough trauma to the chest, you can actually make the heart fire. What I mean by that is, if you were to take a beating heart, and actually press it with your finger, you can make it fire. And so if you take a hard enough hit to the chest, even though the heart is protected by your rib cage, there's all types of fat around the heart, you can still have that same impact be the equal to you thumping the heart. And what happens is, if you get that hit at just the right timing, you can make the heart go into complete disarray and go into ventricular fibrillation. Examples of this, this is from a video. This is from the 90s. This shows a martial arts where a kid gets punched in the chest just right, and what happens is he actually has sudden cardiac death instantly. What actually occurs with it is, where you have the hit, the impact is right here. In the timing cycle, you can induce ventricular fibrillation. Now, this ventricular fibrillation, especially in a person who is exercising, already has built up lactic acid within the heart muscle cells from the event that they're doing, means that it most likely will not convert back to normal rhythm, and it leads to a very deadly spiral from there. You only have a short amount of time to restore the heartbeat. The more the heart stays in this rhythm, the more likely it is it's not going to come out of it. The acid builds up inside the heart, acid builds up in the body, you get very acidotic. The brain does not have oxygen to it. Brain cells start to die within just a couple, 3 minutes. Detriment occurs. Now, in the case of the Buffalo Bills player, he did receive CPR in the field. Good chance through the CPR they were able to circulate some blood and some oxygen to his brain and other vital organs. Again, a lot of the details are not known, but how long it took to restore the heartbeat is also very important. But if he did receive effective CPR, that could make all the difference. in hindsight, it's always tough. Somebody falls down on the field, the first thing you think of, he's got a concussion. That would seem the very logical thing. So most people probably did not think of sudden death as being the first thing that knocked him out. They probably thought, man, he must have took a big hit and got a concussion, which would be the most logical thing to think. So the question is, how much time before they realized that it wasn't a concussion, that it was actually sudden death, he didn't have a heartbeat until they started doing CPR. Again, at the time, these people have a very hard job to do because they have to assess what's going on in a very rapid rate with hundreds of thousands of people watching throughout the world as you're doing this. So I know those guys appear to do a great job, and people should praise them because they work very, very hard, and hopefully he will receive at the hospital, which I'm sure he is, a hypothermic protocol where they actually chill the body and chill the brain. It's absolutely amazing. I've seen this occur in people that have had sudden death, been down a lot longer than him, wake up and they're completely normal. It's the most amazing technology out there, and I'm sure he's receiving that. So I'm very hopeful that in about 3 days from now, we'll get word from the medical professionals that's caring for him that he's doing well and waking up. That's just a quick overview of sudden cardiac death in athletes. Again, questions I get asked all the time. They've been asked a lot in the past day. Please tag at the bottom. If you have any other questions, I'll be glad to answer them. Thank you.